Welcome back, everyone. Well, we're happy to have orthopedic surgeon Dr. Jerry Lorio with Arkansas Surgical Hospital here to talk custom knee replacements. Thank you so much for being here with us. So custom knee or just knee replacements in general have become really common. Talk to us about that.
Yes, knee replacements have been around for years. When I trained 20 years ago, it kind of became routine. You would cut everybody the same knee. The classic cut would be 5 degrees of valgus, which is turning the knee out 3 degrees of rotation, and then just balance the soft tissues, whatever that means. And sometimes with extreme deformities, you'd have to release all the ligaments on one side, basically giving someone a grade 3 MCL. And I always hated that, so I've worked out a way to fine-tune it with a bigger bone cut and less soft tissue releases.
So not every time, not every knee surgery ends up being a replacement. Sometimes you can do other little minor things to kind of help the patient out.
Yes, so we go through classic non-operative treatment. Someone comes in with knee pain who's elderly. We start simple with things like weight loss, exercise, anti-inflammatory, cortisone shots, hyaluronic acid shots, therapy, arthritis cream, alternative shots. But when they reach that point where the quality of life is deteriorated and they're ready to move on, I see knee replacement as a true cure to arthritis. We're removing the disease, throwing it away, gluing in something that lasts 20 years, 95% of the time.
Which is so awesome that there is that solution, because sometimes arthritis, depending on where it is in the body, you can't always do stuff about it. So it's great that they have this option. But one of the cool things that you guys do is you make knee replacements, but they're custom. So talk to us about that.
Yeah, so we don't go in the back room and mold a custom knee replacement. But we custom fit a conventional implant to the knee. Every knee has a unique design. Some patients I see have straight legs, some are bow-legged, knock-kneed, they have flexion contractures or the knees bend backwards, and we've designed a series of bone cuts with an algorithm to accommodate for those deformities or combinations of those deformities, so they can get up with a stable knee that day and start walking.
Wow, so same day as surgery, patients can walk?
Yes.
Wow, that's incredible. And I saw something in the notes you guys sent about a robot. Explain this.
Oh, I'm the anti-robot surgeon.
Oh, you are? Okay.
I cannot stand that idea. I think the surgeon has to guide the plan and make the decision for the cuts. Probably the most commercially advanced robot is the Roomba, but I wouldn't turn that loose in someone's knee.
Very true.
With a saw. It's not artificial intelligence. So it's really about the plan and the execution.
So when someone is having knee problems, when do you think is the time for them to kind of consider surgery or to make an appointment with you guys?
Yeah, I think if it's been a few weeks and doesn't go away, and it's not locking, catching, or giving way, that would be more urgent, but come on in for an evaluation, get an x-ray. Most of the people with arthritis are 50, 60 years old and beyond, but sometimes it can happen earlier. But there's things we can do to help put off surgery if you come in the early phases. Yeah,
that's great news. That's great news. And just really quickly before we run out of time, why do you like working there? What sets it apart, you guys at the surgical hospital? Yeah,
it's a great place. They opened in 2005. The staff are very compassionate, hand-picked, talented, service-oriented. The patients love it. The rooms are set up for patient and family. There's a low staffing ratio.
Oh, that's great.
To the patient, so they get a lot of care, and it's surgery only, so there's not a lot of infection in the hospital, and they have a below national average infection rate.
That is awesome. Well, thank you so much for being here. A lot of great information that you gave us. Check out the surgical hospital if you're wondering about knee replacements. Once again, thank you so much. Coming up next.